right, November is Lung Cancer Awareness Month, and joining us this morning to talk more about some of the changes happening in the medical industry is Dr. Ravi Patel. Dr. Patel, thanks so much for joining us this morning.
Thank you, Alex.
All right, so let's talk about how this impacts us first here in Kern County. You know, when we think of lung cancer, I think a lot of us might think of people who are active smokers and so forth. But for us here in Kern, we deal with some of the worst air quality in the nation. Does that have an impact on us?
Very good question. And there's always been a fear that, you know, we have, because of the exposure and the air quality, a higher risk of lung cancer. Not really proven yet. Okay. So don't leave Kern County. Please stay here.
Right. Yeah, that's a good message. But let's just, again, this is still impacting so many people across the nation, across the world, but here in Kern County as well. What are some of the treatments going on right now to target this?
Well, you know, there are three main kinds of treatments. One is what is called chemotherapy. The second one is called radiation therapy. And then also surgery is another option. So, you know, when an individual is younger, the cancer is localized, the best option is, of course, to remove it. And fortunately, there's been very sophisticated ways of removing it. In the past, we had to do a big incision. Now they can use robotic surgery, video-assisted thoracic surgery, which can target the tumor with minimally invasive changes for the patients. Very good patient outcomes.
When we talk about cancer, a lot of us think, especially with different types of cancer, but specifically lung cancer, again, we think about those who have smoked a lot.
Yes.
Is it just those people who smoke that is being impacted by lung cancer, or are there other groups of people that are still susceptible to this?
That's a very important question also. There is a percentage, fortunately not a high percentage, but a small percentage of individuals who have genetic mutations and are non-smokers and could potentially develop lung cancers. So it's very important to remember that if you have a cough, even if you're a non-smoker, the cough has not been going away, get it checked out. And if you're a smoker, very important to get it checked out all the time. And that's where what is called low-dose CT scanning comes into play.
Well, we're running low on time, but I got to ask you about the symptoms. What are some things that you want people to know, to be just kind of aware of, to see, maybe I need to get this checked out?
Yeah, so if you've been a smoker, and if you have what is called a 20-pack-year history of smoking, you've got cough, shortness of breath, chest pain, important to get it checked out. And low-dose CT scanning is a very important screening tool. We're doing it all year round for free for patients who have smoked about 20 years of smoking, 1 pack per day.
All right, Dr. Patel with CBCC. Thanks so much for joining us this morning. Important info here to talk about. Appreciate it. Happy Thanksgiving. Enjoying your week.
Happy Thanksgiving to all of you.
All right, we're going to recap our top stories coming up after